How do we hear? So we have these two big old floppy things on the side of our heads, and the way they are designed, they actually are designed to be sticking out. It's important that they do that because they're a funnel. So they actually are designed to actually capture the sound and funnel it down, and that's why there's all little bends and twists in it. It's on purpose, that it captures the sound and funnels it narrowly down into that ear canal. So we have a couple of parts. I'll just educate you a little bit. The outside part is called the pinna, P-I-N-N-A, pinna. Then you have the ear canal, which is the tube that runs down through the ear. That's what catches all the wax and oils and kind of funky stuff. Now the wax and oils are only on the outside portion of the ear, externally. Deep inside, the inner third is actually very thin skin with bone. That's why it's very painful if you get something down in your ear, because there's very little skin there protecting that area. And at the end of the ear canal is the eardrum. And the eardrum is actually three layers, three very, very thin layers of skin pulled tightly and held in place by a little tendon. And the reason it's a drum is the same reason that you see a drum, and the function of it is the same type of way a drum works in a band. You hit it and it vibrates. Well, sound waves actually hit that eardrum as they're funneled narrowly down into the ear canal, smash into the eardrum, and move it in and out, vibrating it back and forth. Connected to the eardrum are the three smallest bones in our body. They are so small that you could actually put all of them on the end of a pencil eraser. Three of them. They're tiny, tiny, tiny. They are called the ossicles. Okay, and sometimes you'll hear them as the anvil, the hammer, and the stirrup. It's the malleus, incus, and stapes. That's not nearly as much fun to say or remember. So anvil, hammer, and stirrup. And those are very important. They connect to the eardrum and then also to the inner ear portion that's called the cochlea. The inner ear portion of our ear, the hearing organ, is actually called a cochlea, and it's shaped like a little snail shell. And there's two sides of it. One side that's shaped like a snail shell, the cochlear side, actually houses the hearing organs. The opposite side actually has little loops on it that look like semicircular canals at different angles, and those actually control our balance system. So our auditory system and balance systems are actually interconnected through fluid chambers inside our head. Balance system being interconnected, this is why often, especially if you went to an emergency room or went to a physician's office, they will recommend you get a hearing exam if you also have a balance problem, because there are times where it helps us understand what's going on with the balance system by testing the auditory system. It helps us narrow down what the actual problem is or diagnosis is. So this is not a talk about the balance system. I'm going to leave that alone. I want to focus more on the hearing system. So the cochlear hearing system is a snail shell, and there's three fluid chambers on the inside of it. And those fluid chambers will kind of move up and down. So we were talking a little bit about the eardrum and the ossicles, and when they move in and out with sound waves, it moves in and out this fluid. It changes the pressure inside the ear. And there are tiny little hair cells, thousands of little tiny hair cells inside of that cochlea. And so all of this is very microscopic. But once we get down into the hair cells and things like that, that's all microscopic. So these are tiny little hair cells, and each hair cell has a very small nerve cell that's attached to it. So every time fluid moves inside that cochlea, it bends and moves these hair cells. And when those hair cells bend and move, that activates the nerve, the auditory nerve. And the auditory nerve runs from deep inside our head. It's actually right about here inside your head if you drew a line straight in and straight down, right about here. And then that runs back up to your brain stem back here, up and then up to the temporal lobes on the sides of your head. So that's where the auditory nerve kind of goes from the ear back and up. So our ears are a tool. They pick the sound up. So all these sound waves and vibrations that take place activate and move these hair cells. They do their little dance. That shoots off the auditory nerve fibers, and then they stimulate areas of the brain. So I like to think of it as keys on a piano. So each key on a piano is tuned for a different sound, correct? Okay. Each hair cell that's in our ear is tuned for a different sound as well. So is the nerve. And then the same nerves are activated, tune out different little cells in our brain. So our brain is actually, the information that it receives from the ear stimulates the same type of frequency or pitch sound in our brain. It's how the brain figures out that when I say cat, you understand it as cat, because the same centers of the brain pick up C-A-T, cat. Now, with hearing loss, what happens? Anybody have a guess? Nerve cells can get damaged, absolutely. So the most common type of hearing loss is called sensory neural hearing loss. Sensory because the cochlea is the sensory organ. It has some damage. Neural because it could be nerve fiber damage. Now we use sensory neural because it's sometimes hard to diagnose. Is it really a sensory problem? Is it really a neural problem? There are some tests that you can do, but not every office has it. And the reason they don't is because the treatment is usually very similar. There's not a lot of different treatments when it's a sensory loss versus a neural loss in some cases. So when the organ of hearing, your cochlea, is no longer picking those sounds up, those little hair fibers get broken, or they stop working, or they go away, disappear. When that happens, they don't bend. So then that nerve fiber doesn't get stimulated. And if that nerve fiber doesn't get stimulated, your brain doesn't know that the sound was made. So this is why patients will a lot of times tell me, I feel like I can hear. I know somebody is saying something. I can't understand it. It doesn't make sense. It sounds mumbly. It's because we don't lose all our hair fibers all at once. You'd go deaf. And that happens, but it doesn't happen. The standard cases is where it happens very slowly over time. So you may lose a little bit here or there. And when you lose a little bit here or there, we begin to kind of compensate for it. Oh, other people are mumbling. It's not me. It's not my ears. They're not talking correctly. But what it is it's actually your brain not getting the right information, so it doesn't know that the sounds are taking place.